I'm Dr. Jim Partington, and I'm board certified behavior analyst at the doctoral level who's been working in the field with children with autism and other disabilities for the last 46 years. During that time, I've also taught at universities and have written books and assessments that have been useful for parents and teachers to learn how to effectively educate individuals with developmental delays. When parents realize that their child's received a diagnosis of autism, the first thing they do is start looking for help. And it's very important that when they begin their search, that they really look at people who have been in the field for a long time and are actually delivering competent services. In order to develop an effective intervention program for a child, you need to know exactly what the child knows and doesn't know so that you don't waste time attempting to teach them skills that they're not quite ready to learn. We use the ABLES-R and the WebABLES to assess the children and find out what skills they have, don't have in many different areas. The reason we use the WebABLES to assess and track a child's skill development is because it's a single tool that provides a comprehensive review of the basic skills that the child needs to learn in order to effectively interact with and learn from their everyday interactions with others. It's a comprehensive assessment, and that's the key. You want one comprehensive assessment as opposed to many pieces and try to figure out how they all fit together. The WebABLES does that for parents, and it makes it easy for them to see if their child's making progress in all areas or if they're not making progress. And if they're not making progress, then we can dive into it and figure out what we need to do to help the children learn those skills that they're having difficulty with. Here at ARN, we also incorporate what's called verbal behavior. The verbal behavior analysis takes a look at expressive language and breaks it down into how a person uses expressive language. For instance, it's not just enough to be able to repeat words, but you also need to be able to ask for things that you want, label things that you see, and also be able to talk about your experiences and things you know about that aren't present at the moment. So at ARN, the staff who are highly trained implement these training procedures with a high degree of fidelity. That is, they're consistent in what they do and they follow a plan which has been developed on an individual basis for each child in the program. All the children are different and they each need their own plan. I endorse the services that are provided by the Autism Recovery Network. 13 years ago, I began training their staff and helping them set up their clinical systems and provide ongoing supervision and also provide assistance to them in reviewing cases. The services that they provide are definitely high quality, and if you're a parent, I think when you're looking for services, I would recommend that you at least make an appointment, come by and talk to the staff and let them hear your story and see how they might be able to help you individualize the treatment that your child needs.